To remind you that if you did not do Section 1 or Module 1 of the Non-Emergency Transport Program, please stop and return to that. Today we're going to be talking about passengers with disabilities. Obviously, every passenger that we have probably has some kind of sickness, illness, or disability. And we're going to get into depth just a little bit about those disabilities and what it means to the impact on transport. So, a non-emergency medical transportation operator must be prepared to meet the needs of their passengers with disabilities. A lot of times this includes answering repetitive questions, looking the patient directly in the face when speaking to them if they're hard of hearing, helping the patient readjust their seating inside of their wheelchair. There's a multitude of things that need to be done to accommodate these patients. We need to have a basic understanding of various disabilities in order to better serve the patients that we have. And it's important that some disabilities are acknowledged as having occurred from a very sudden onset. And the reason being is that there's a lot of psychological issues that go along with patients who have suddenly suffered an acute onset of a condition. And there's also some psychological factors for patients who have been struggling for a very long time with a disability. So both of those factors affect transport. So we have a video that discusses disabilities and factors. We're not going to get into that this afternoon. There are multiple articles listed here. This will be put in the resources section for you at the end of your student workbook. Let's just move on. So first of all, we'd like to talk about people that are visually impaired. Generally in the class, when you're watching this, a piece of tissue paper will be put inside some glasses for you to put on to see exactly what it's like to have cataracts or a visual impairment. A person is considered to be legally blind if they have a best corrected vision of 20/200 in their best eye. The primary obligation in transporting any passenger is that you're ensuring that they enter and exit the vehicle safely. It's critical and essential with a vision impaired passenger that we escort them to the vehicle. So we're not going to allow them to take hold of their own wheelchair or anything like that. And when you're approaching a person who's visually impaired, you want to approach them from the front, introduce yourself, and let them know everything that's happening all along the way. So, hello, my name is Rachel. I'm here to transport you to your doctor's appointment. I'm going to go ahead and get behind your wheelchair and we're going to go outside to the van. Every step of the way, it's important to let these patients know what's going on because they're missing one of their senses and they don't for sure exactly know what's going on. If for some reason you have to stop short or the road has construction and there's a lot of loud noise, these are all things that we need to translate to these patients to make sure that their transport not only goes smoothly, but they feel comfortable and safe. We also have patients that are hearing impaired. Obviously, as we get older, our hearing is definitely impacted, especially those patients who worked in loud environments in their youth. Hearing impaired individuals, they rely upon visual communication a lot of times to understand what's going on. A lot of them do lip reading. Few of them have learned sign language. It's important that we want to face those patients so that they can directly see our face when we're speaking to them, which at times can be difficult while you're driving. So it's important that you communicate that to your patient before you start driving. And we also want to treat our hearing impaired passengers as though they are regular passengers. So even though we may have to raise the level of our voice, we want to raise the level of our voice but avoid screaming at the patient. So we want to make sure that we're clearly facing them and that we're clearly describing to the patient what's going on. It's also very important that we're using phrases and sentences that aren't overly explanatory. Because if you're reading lips, sometimes it's difficult to read words that you don't commonly see. So we're going to talk about a little bit more at length about behavioral and developmental disabilities. Cognitive disabilities does loop into this. Mental illnesses are looped in as well. So illnesses and disabilities that affect the way an individual thinks, behaves, interacts, and relates to others can be challenging to anyone. Especially those behavioral disabilities where the patient can consistently do the same thing repetitively over and over again, ask repetitive questions, have a multitude of quirks, such as pulling the same ear, things like that. It's important to be aware that regardless of the type of disability, the passenger's needs do not change. If the patient is being escorted by a family member or medical staff person, your level of responsibility is not diminished. It's important that you know that that patient is a person and they are your priority. So if you do have an escort for this individual, which you should have an escort for this individual because they have a mental status that does not allow them to support their own decision making, it's important that you are also communicating to the patient along with the attendant. So it's never okay to have a conversation with the attendant regarding the patient without also attempting to tell the patient what's going on. And it's important to refrain from any kind of conversations with the attendant that are regarding the patient and the patient's condition, or are just basic conversations that are leaving the patient out to sit in the back seat and watch a conversation go on. If for any reason a passenger that you are transporting suddenly becomes irritated or unruly, it's important that you pull the vehicle over and use calming techniques for the agitated passenger, which can be conducting some social conversation with them, maybe finding a point of interest of theirs and talking about that and getting them calmed down before you continue to drive. If the passenger becomes severely uncomfortable, you need to stop the transport and report the situation to your dispatch and your manager. We need to ensure the safety of our patients first. Getting to an appointment on time will always come second to the patient being safe during transport. If for any reason your comfort level is compromised, you need to pull the keys out of the ignition after you've stopped the vehicle, exit the vehicle, and stand behind the vehicle and contact dispatch. There are times when patients can be excessively touchy-feely or excessively aggressive, throwing objects or spitting or kicking. That's definitely not okay. It's not okay to your safety, and it's going to be important that we translate that information so that we can get you into a situation where you're safe. Passenger conveyance is just a big word for talking about communication with your passengers. Commercial passenger vehicle operators, particularly non-emergency medical transporters, are definitely expected to do more than just drive a vehicle. There's a significant portion of their job that may involve speaking with or assisting passengers inside and outside of the vehicle. It's really important to communicate actions and answer questions in order to make your patient feel safe. I've had employees in the past that have gotten the music preferences so they can play a little light music, who have maybe taken a different side street because the patient used to live on that street and wants to drive past their old house. Mileage wasn't different. It's just accommodating to that patient to make their transport pleasurable. And the reason that we're doing that is because a lot of times these patients are in facilities and they're coming in and out of facilities, and the only experience that they have in the outside world throughout the course of the month is simply the communication that they have with us. So it's very important to provide a positive experience. And for the most part, wheelchair drivers are the face of the company. They generally see the patient before the patient begins qualifying for a stretcher. They are what that patient grows to expect out of the company. And if we provide the patients with a level of safety and understanding and make them comfortable within our means, it definitely helps them along the way if their condition actually worsens. So this afternoon, we're talking about wheelchair safety features. There are a multitude of wheelchairs. A lot of this is going to be included in your student workbook. This module in particular is Module 3, and it's going to cover the following equipment: pediatric wheelchairs, fixed leg and adjustable leg wheelchairs, spoked wheels versus wired wheels, and reclining full and partial wheelchairs. You're also going to encounter wheelchairs that have the following equipment: anti-tip bars, oxygen container components, various specialized attachments and provisions, and corrective posture options. So the standard wheelchair or the manual wheelchair is the wheelchair that most of us see throughout transport during the day. Most of the time a patient is in a wheelchair ready for transport when we show up to get them. There are times when we do have to provide a wheelchair, which we have a place that we secure that within the vehicle. Those chairs are generally 18 inches wide, and they are self-propelled, although we generally need to be pushing that wheelchair when transporting the patient to the vehicle. And those wheelchairs need to have leg rests. We cannot transport patients who do not have leg rests on their chairs. This is important for a multitude of reasons. Transit wheelchairs are another type of wheelchair that is used generally in airports or in hospitals, and they have small rear wheels. They don't have any push rims, and they are generally not used for transport in a wheelchair van if they do not have locks on the wheels, which the majority of these do not. So you should not be, for the most part, transporting a transit wheelchair unless for some reason it's a wheelchair that has the ability to lock the wheels. Power wheelchairs can be very heavy. The average power wheelchair is somewhere between 350 to 450 pounds prior to putting the patient on the wheelchair. They are battery powered, and they do have a drive system that includes a joystick or a control bar. Patients who use these wheelchairs generally go in the electric lift wheelchairs, because those are larger vans that will accommodate the patient. It's important to remember that your patient is going to weigh somewhere in the range of anywhere between 600 to 900 pounds on that electric wheelchair. So it's important to make sure that the height and width of the chair is going to fit inside of the vehicle. And if at any point there's any question about that, you can measure yourself, you can talk to the nursing staff, or you can call dispatch and they can assist you with that. Because the last thing we want to do is get a patient inside of the vehicle and then them be incredibly uncomfortable, or for us to have an experience where we're attempting to stick a patient inside of a vehicle, and it's very embarrassing when you're too big to fit inside of the vehicle and everyone's watching. So with both power wheelchairs and bariatric wheelchairs, which are roughly 26 inches wide or 30 inches wide, which obviously is a big, vast difference between the 18 inches for a standard chair, it's important that we make sure that that chair is going to fit inside the vehicle prior to ever taking the patient out into the parking lot. Pediatric wheelchairs are unfortunately something that we do encounter occasionally. They are a smaller version of a conventional wheelchair. They often come equipped with a bunch of specialized equipment and devices, such as the bike handle brakes on the back, special headrests, tilt capabilities, smaller wheels in the front, a second set of brakes in the front and the back, and special leg rests. These chairs are generally used for patients who have some kind of neurological disorder, primarily cerebral palsy, and they have specialized hooks on the side of them, which we're going to see later on in the program, that allow us to strap them into the vehicle very easily. So there's some special considerations that you need to take into account with wheelchairs in general. Special attention should be noted for passengers of single or double lower extremities that have been amputated. So if a patient has an amputated extremity, we're looking at an affected center of gravity. That center of gravity has changed, and the restraints for that patient will also change in order to keep them upright in the vehicle and safe for transport. Obviously, there's no reason that a patient could not be transported if they are an amputee, If they are an amputee with an altered mental status by themselves, that would be different. If they're an amputee who consistently slides out of the chair despite all of our restraint options to fix the center of gravity issue, obviously that's different. Displaced body mass presents tipping dangers in respect to passengers who may be either is affected by amputees. And you do have in your student workbook this diagram, which shows the center of gravity being right about here, or belly button level, on a patient who is not an amputee. And this is explaining the 45-degree lap restraint, which comes across the lap. And it's important that we look at that because the restraints for amputees are definitely different. So if you have an altered center of gravity, you're no longer looking at your center of gravity being at this belly button level, but we're now looking at it being somewhere across the chest, or right below the chest, across the ribs. So the restraint across the legs may change briefly, but the restraint and the height of the restraint across the shoulder will change quite a bit. So that factor is important to understand. If you can see that that shoulder belt is coming across, and in specific, it's been shortened at a level where it lays on the shoulder and puts a good amount of coverage over the chest. We're going to move on to talking about liftgate inspection. In our company currently, we're no longer using liftgate vehicles. So I'm going to refer you to this website here. It's going to be a YouTube video, and there's the watch code. If you could pause that and write that down. It's going to be important that you watch that section. The man is doing a liftgate inspection on a bus, so some of it does not apply to us, and some of it does. There will be an appendix to this program where I do a narrative on this video while watching it, kind of like a reaction video, but we're not going to do that right now. So this is the wheelchair operation and loading vehicle, and we are going to have to take a look at that because that's actually very important. So we're going to go ahead and head into that for a moment. Okay. Okay, so I just want to give credit to the individual who made this video, which is why the splash page came up. He is going to talk for just a brief moment about incidents that have occurred with people getting injured because of their wheelchair or because of their situation with the wheelchair. And then we're going to move on to how to appropriately load a wheelchair into the van. So when we're looking at letting go of a wheelchair, that's never an okay situation. When we're getting ready or preparing to load a patient into a wheelchair van, it's important that we lock the wheels, we have the patient within our sight, and that if we do have to take our hands away from the chair, the patient is at an angle where the chair can just simply not roll. That's something that we will cover in the practical section of the course, but that's definitely something to keep your mind on. So we always lock, and we always have to be able to see the patient, and the patient has to be positioned in an area of safety. So we are looking at preventing accidents, and preventing accidents start with proper training, which is why we're doing this program. So it'll be important for those of you who are using a power lift in specific to learn not only the components but the troubleshooting that goes along with those lifts in case anything goes wrong. It's also important that we get in the habit of and continuously secure our patients the way they are supposed to be secured, despite the fact that some wheelchair vans have a well that you push the patient down into. We still have to use the appropriate straps necessary to secure that patient, because although it may seem like overkill or too much, it's actually required for a reason. Practicing before you begin this position, strapping a wheelchair into the van multiple times is very important and part of our practical skills that we will cover later on in the course. Regularly checking the wheelchairs that you're transporting as you're pushing the patient out. Do the wheels seem to be loose? Are there missing screws? Are there parts of the wheelchair that appear to be broken? And then not transporting those wheelchairs or communicating that information to someone who can fix it. So we're going to move on. Okay, so we're going to move into the area where we are talking about how to appropriately secure a wheelchair. I am going to voice over a portion of this. It's important that we pay attention to this because this does become part of the practical skills. It can be re-reviewed if necessary. So we're just going to skip ahead. This is a wheelchair being loaded into a van for a side load, power load. Again, access to this video is written within the slideshow. We're doing this primarily for the portion that involves how to actually secure the patient once in the vehicle. So we're going to go ahead and skip ahead to the patient actually being inside of the vehicle. Again, the power lift portion can be viewed by going to the original video. So we're going to look at that loading now. Most of the time with the van, you're going to have outside components that will hold the door open, or the van itself will have mechanisms that hold the door in place. High winds can blow these doors back onto the vehicle, so there's usually a clamp on the outside of the vehicle, or the company will provide you with a bungee cord of some sort to secure the door prior to ever moving the patient. You'll notice as she lowered the lift that she had her eyes on her patient. Her patient is to the side with the wheels locked. You'll also notice that that lift landed on flat ground. If for any reason you are using a power lift, you are to place it onto the ground, and the yellow flap, which became flat to roll the patient on, does not lower. It is because the ground is not level. This is a safety mechanism within the vehicle. Okay, so we're effectively communicating with our patient and letting them know that they're coming into the vehicle. We're keeping our hand on the wheelchair. That's not only for their comfort, but for us to feel that things are going appropriately. And we're also getting ready to move the patient into the vehicle, but we have locked the wheels onto the ramp. It's important to know under no circumstances, if you are using a power ramp, you are not to get on the ramp and ride it up with your patient. All right, now let's go ahead and look at the patient actually being secured into the vehicle. So those Q straight tie downs have a special pin that fits into a track on the floor. It's important to our company that we keep our vans clean. The lack of debris in those tracks really does ensure that those Q straight stay locked down properly. At the end of every shift, wheelchair van drivers and operators should be sweeping out the back of their vehicle and disinfecting and cleaning and removing any trash. This just makes it all around for a safer transport. So, those hooks on the wheelchair are very common in the adjustable wheelchairs that we spoke about for pediatrics. They're not so common with standard wheelchairs where we're transporting out of nursing homes. In that instance, we're going to want to go around the wheel, not through the wheel, and connect directly to the support bar underneath of the wheelchair. This can be done in practicals for practice. It is important to note that those Q-straight bands do have a small red lever on them, which will allow you to loosen the strap. There is a crank on that Q-straight that will allow you to tighten it. It's quite obvious that she did tighten it, but she didn't tighten it to the max. Tightening it super tight may make it very difficult to get them off. Now, during transport, it's important to note that you need to have 4 secure points from the floor and also your lap shoulder belt on your patient before you transport. All right, so let's take a look at that cue straight before we move on. So this is the red lever that is used to release that belt out of the fixture when necessary. It's also used to release when we are done transporting and need to remove the patient from the van. You will see that there is a crank here. That crank is for tightening down, and we will see right here that this is the track, and this component sits inside of the track. There's also a level within these that you can see, and I will show you in just a moment. So there's a level right here that allows you to see that you are level with the floor and that your straps have been put in appropriately. So let's go ahead back to our PowerPoint. So wheelchair passenger transfers. There may be situations that require you as the operator to remove a passenger from their wheelchair during transport. For instance, you have to evacuate the vehicle. It's not safely secured mobility device. Like I said, maybe the wheel is falling off of the wheelchair or something like that. Once the decision has been made to transfer, the second crew person, if available, should be close by for assistance, or an attendant, or a nurse, or someone with the appropriate patient movement training. We will talk briefly about patient movement in the practical section of the course. But these are the circumstances in which this might happen, and you definitely need to be supported by another medical professional or someone of equal training as yourself. So, ambulatory assistive devices can be taken with us during transport. There are pediatric and adult walkers, but there's also other devices such as canes and crutches. Those can be taken in the wheelchair van. I know the patient will be in a wheelchair, but maybe they need to show the doctor at their doctor's appointment that they're walking effectively with their walker. Or maybe they just want to be able to get themselves to the bathroom. These devices can be taken provided that they are secured appropriately within the vehicle. They can be done with either a safety restraint or a bungee cord. There are a multitude of child transport laws. These are important to know because, like I said before, there are instances in which you will have to transport children. These are just the state qualifications for what type of child seat needs to be put in the vehicle. Infants are between 4 and 22 pounds and should be rear facing. Children are between 23 and 40 pounds and should be rear facing until 30 pounds and then forward facing after 30 pounds. Booster seats can be used for patients between 40 pounds and 60 to 80 pounds. It's noted in the state of Ohio laws that any child under the age of 8 years or 80 pounds should be in some type of child restraint seat in the rear of the vehicle with a lap shoulder belt. So some of your responsibilities, and this is very important, you take custody of that patient when you take them on into your vehicle. If you're returning a passenger home or to a nursing facility, you are obligated to transfer that care to someone else at that site. We can't just take Mr. Jones and leave him on the sidewalk for a cigarette outside of the facility. It's important that we take him inside and we let the nurse know that he's been taken back inside, and that we lock the wheels and leave that patient in a position of safety where the facility staff or family know where that patient is at. When we're interacting with passengers, we need to understand that a lot of them are of advanced age and might be experiencing some level of pain or some level of discomfort. So it's crucial that we practice professional courtesies to meet the needs and challenges of that, and just try to put yourself in that passenger's place, looking at the fact that it could be incredibly painful all day, every day, and that could definitely make you very disgruntled or unhappy. And then when interacting with medical staff, especially in the recent times we're facing, staffing is short. Nurses are stretched thin. There's a lot of demands and requirements in the medical field, and you may not always get the friendliest or warmest communication out of medical staff. It's important to have a level of understanding because it starts with us. If we stay calm and patient with the staff that we're working with, then oftentimes that de-escalates any kind of feelings that they have going on that they may be projecting onto us that, we definitely didn't cause. So we talked before about interacting with escorts, some examples of why you would have an escort in your vehicle with the patient. There could be a language barrier or speech impairment. It could be a hospital or clinical policy. Patient could have an altered mental status. The patient or the patient's family could have just asked for an escort. Or the family member is escorting the patient, doesn't have the correct vehicle, but would like to be there to advocate for the patient at an appointment or a treatment. It's important that those individuals are seat belted, just like anybody else in the vehicle. It is a law within our state that, you have to have a seatbelt on if you are in a vehicle that is in motion. And those escorts are there for the needs of the passenger and should remain in the immediate area of the passenger. So we're not going to stop off at McDonald's and let them run in and grab a burger. They are there to be supervising that passenger, and that's how it needs to be at all times. It's important that you are staying in control of the situation. You are the transport, which means that ultimately you have custody of the patient and you are responsible for the vehicle. So unfortunately, policy should always stop you from taking the patient anywhere except for from A to B. So if they're required to go from the nursing home to the doctor, that's the only place they can go. We can't run by the corner store or let them come by an address that's close or stop by their favorite restaurant to get something to eat. And definitely avoid the complaints about doing your job. If you're required to secure a patient, you're required to secure a patient. So even if they're angry that you put a seatbelt on them, it's still required, and it's important that you stand your ground. And if you're having issues with these things, make sure that you're contacting your supervisor and your dispatch to get the necessary support in order to do your job appropriately. It's important for you to know that we are not privy as wheelchair drivers to a passenger's dietary restraints. Some patients can have no food by mouth or thickened liquids or diabetic concerns or sodium concerns. So no food within your vehicle or no outside food at any time or liquids should be given to a patient. You could put that patient at serious risks. So it's important that we do not feed our patients. In the next section, we're going to be talking about forms and reporting. It's very important that when we are doing our reporting, that we are being very specific and we are indicating what's going on with our vehicle and our patients. So this has been section 2. We're going to be moving on to section 3. If you have any questions, please jot them down in your workbook now, and they can be presented to your trainer for discussion. It's always important